Hello, my name is Angela Bryan, and I am a senior at Iowa State University majoring in Animal Science Pre-Veterinary Medicine. Within this presentation, I will be covering laminitis in equine, specifically Pasture-Associated laminitis. We will first cover the initiation of this process, followed by the internal mechanism that is occurring, followed by the symptoms or external presentation of this condition, internal effects, and lastly, preventative measures owners can take. What is laminitis? Laminitis is a debilitating condition seen commonly within ponies and adult horses, a condition manifesting in the foot as severe pain and inflammation of the laminae. There is a specific separation of the hoof wall from the rest of the hoof. And as you can see in the photograph to the left and below, the bone will rotate and pull on the flexor tendon. So what are laminae? Laminae are located within the wall of the hoof. These objects are responsible for dissipating the concussive forces that occur when horses are in locomotion. In Figure A, you can see the laminae attached to the inside of the hoof wall. In B, you can see a diagram of the sensitive laminae. Association of the pasture to laminitis. To begin, I'll cover a little bit about pasture and its contents. Pastures are greatly variety of structural and non-structural carbohydrates. These carbohydrates include simple sugars, starch, and fructans. With respect to increasing the risk for laminitis, however, fructans are found within some pasture grasses and are the most important. Fructans are non-structural carbohydrates, molecules which enzymes within the small intestine are unable to break down. Because of this, the fructans bypass digestion and absorption, two processes generally elicited to all nutrients consumed. Because the fructan structures are not broken down, they are presented to the large intestine fully intact. Microbial matter of the large intestine then ferments the intact particles and produces the increased acidic environment that contributes to further problems. So what are the periods of risk? Within the pasture, the higher the fructan content, the higher the risk to the horse. Despite the fact that fructans clearly pose a problem to the health of pasture-fed horses, there are management procedures that can be implemented to limit the occurrence of laminitic problems. Most generally, fructan content is greatest during active periods of plant growth, periods that largely encompass the months of spring and early summer. During hours of daylight, the plant is actively undergoing photosynthesis. On the other hand, the plant is using its previously photosynthesized carbohydrates for growth during the dark hours of night. Overall, concentrations of these carbohydrates rise during the morning, reach a maximum in the late afternoon, and decline overnight. In addition, stressors may increase the content of fructan within a plant as well. Cold stress increases fructan content, especially on cold autumn mornings. Overcast will also affect these results. As the graph shows to the right, water-soluble carbohydrates are greatest within fresh grass and dried grass, which this research can relate to with the greatest plant growth. So what is the internal mechanism of this condition? Science clearly suggests that the development of pasture-associated laminitis is actually based on an initial drop in the pH of the large intestine of the horse. So to go through the steps. Step 1. The sugars and starches within the intestine are fermented. This produces a lactic acid and an increasingly acidic environment. The newly acidic environment of the intestine causes acid-sensitive microbes to deteriorate and acid-resistant microbes to flourish. Although still in question, it has been assumed that after being absorbed by the large intestine, these bacteria then travel through blood vessels to reach the hoof wall. The bacteria may then produce substances that can activate specific enzymes within the wall of the hoof, breaking down the bonds between the pedal bone and the hoof wall. At the hoof, the wall then separates from the pedal bone. This separation causes a displacement of the pedal bone and pulls on the deep flexor tendon as mentioned previously. This leads to the pain and the overall debilitation of the horse. So presentation of this condition, both externally and internally. Externally, a horse will present itself standing with more weight on its hind legs in the attempt to remove weight from the front feet. Also externally, the hooves may be warm to the touch, and the horse may be resistant to walking or turning around. Internally, blood vessels will be constricting. The laminae have been damaged and are pulling away from the hoof wall. At this point, the pedal bone descends, as illustrated in the photo below, from mild to moderate to severe. Blood vessels will then continue to collapse. And as the sole becomes compressed, this leads to crushing and ultimately an infection in the foot. This diagram here also illustrates the condition within the hoof. You can see the hoof wall showing ridges from the external presentation. Clearly recognizing and treating a laminitic condition in its early stages is vital to preventing the pain and suffering associated with this condition. Ideally, avoiding this condition from initially developing would be preferred, and because of which, an implementation of countermeasures and interventions is pertinent to the comfort of these horses. Preventing this laminitis initially involves assessing the risk posed to each individual horse. Determine which horses are prone to developing laminitis. These horses may be overweight or have a history of being overweight. But it is best to completely avoid grazing of the pasture grasses at all when fructan content may be high. As for other horses, there are methods of limiting and monitoring the consumption of fructans and other non-structural carbohydrates. To begin, pasture time should be limited daily, either from minutes to several hours, and avoid grazing during periods of high risk, as mentioned previously. Secondly, grazing should only be allowed during the low-risk times of the day. Even further, owners can implement the use of a grazing muzzle, which will decrease the horse's consumption of these grasses. Finally, paddocks should be rotated regularly to keep the pastures managed properly. Overall, horse owners and barn managers must be cautiously cognizant of the factors affecting the development of laminitis within these animals. Specifically, pasture restrictions should be implemented for highly susceptible animals. Management practices may include full restriction of grazing, of high light intensity, or low temperatures. The responsibility of the horse owner or barn manager may be vital to the health of these horses, especially in preventing laminitic episodes. And with that, I'd like to present the literature I have cited. Thank you for your time.